Hi, welcome to the second part of your assessment of the unwell child, covering all things pediatric. So you have already covered history taking, observations, and the general approach. This part would be the specific advanced assessment. So just a little reminder about our structure that we're going to cover. First of all, we're going to look at meningitis. Sorry, I should say this is only for the non-time critical patients. So we will take history and test for meningitis, for septicaemia, for dehydration, for rash, for fever and fatigue, do a pain assessment, consider which system we might want to assess in addition, and then we'll think about non-accidental injury, safeguarding, welfare, and then we'll finish up with just a roundup and a couple of facts. Right, so let me get the correct place for us to start and we can crack on. Okay, so you'll decide, depending on the presentation of the patient, which focused assessment you might like to undertake for this patient. So what you've done already is the respiratory, the cardiovascular, the abdomen, the neurological. Yeah, I think that's it so far. So if you have a child with a headache, for example, you might do a little neurological assessment on them. You might check the cranial nerves and you might check their cerebellum function. Same if you have a child with loss of consciousness or with an earache. Whereas for a child with difficulty breathing or croup or cough, something like that, you might choose to do a respiratory assessment. Now, for the respiratory assessment, if you were to get this in your OSCE or if you were doing it on the road, I would not expect you to go through the whole thing of, right, let's check the hands. Let's check the hands for clubbing. Let's check tobacco staining. And let's check for any type of beta-2 agonist use. They're not really relevant when it comes to pediatric assessment. What is relevant is literally doing your IPPA. So that's a must. So if the child that you're going to has got a respiratory complaint, I would expect you to expose the chest, to have a little look for symmetry, to look for excessive use of muscles. Then I would expect you to palpate, check that there's no deformities, check for surgical emphysema, check and make sure that the diaphragm and ribs are expanding properly. And I would expect you to percuss. Children can still get pneumothorax. You can decide there whether there's any hyporesonant, meaning low sounds like fluid or blood, or hyperresonance, meaning hollow sounds like trapped air, which you would get in asthma, as well as the classic pneumothorax, which we wouldn't expect our children to get unless it was trauma. And obviously you would also take, now you're going to do this probably on a lot of children, because most children who present to you are either trauma or unwell, like accident emergency. So those that are unwell, forget the trauma for a moment. Those that are unwell, you're going to want to have a little listen to their breathing, check that it's normal. And that goes for, if somebody's presenting to you with maybe diarrhea and vomiting, I would still have a listen to their lungs. I would still have a listen to their breathing. It helps you to assess their effort, which, as you know, is one of the main criteria in the pediatric triangle. So I paused on trauma. Any type of trauma to a pediatric patient that might be involving the torso, I would be listening as well. All right. So bear it in mind. Decide which assessment you want to do. For us, we're going to start our assessment with meningitis. So you have already covered meningitis before. You've done that in neurological system. So hopefully most of you know about this. Just to recap then for you what it is. So if you remember, you've got the 3 layers of meninges surrounding the brain. Sorry, let me just move that to the side again. They're described here in this diagram. Closest to the skull, of course, you're going to have the pia, then you're going to have the arachnoid, and then on the outside you have the dura. So this is where basically in meningitis you can get bacteria and virus in the blood that essentially will travel through the brain. It can come from the back of the nose and mouth, travels through the brain. Any type of infection will carry with it an inflammation of sorts. So if you get an inflammation there in your meninges, that's going to severely irritate your brain. So this is why the signs and symptoms that come up with meningitis really give you the clues. So with meningitis, you are looking at cerebral irritation. So the tests that you do, remember that what they're going to do is they're going to irritate those inflamed meninges even further. So this is why you have things like the stiff neck, is because in the brainstem, of course, there's going to be inflammation as well. So think about your neurological assessment, think about your cranial nerves, think about all of the things that would affect a brain illness. So we're looking at photophobia. We can't stand the lights. That doesn't mean necessarily that they're sitting with sunglasses on, but it might mean that they're in a darkened room, or it might be that when the sun shines on them, or your pen torch shines on them, it really hurts their head. It gives them irritation. It's not nice. They don't want to see that. You might get a headache with it. Very likely you'll get a headache with it. You might have fever, you might have swollen glands, you might have a temperature, you might have a high respirate, anything associated with infection. But with meningitis in particular, we're looking at the stiff neck, the photophobia, the headache. So know the key facts and then think about what else might come into it. I might have told you a story about moi when I had meningitis. And I'm really sorry if I have told you this story before. I definitely have told it at least 10 times. But when I was in my 30s, not too long ago, obviously, I contracted meningitis. I was on shift. Everything was fine. I'd seen a patient. All of a sudden, my glands went up. I was like, what? What's happening? Like literally within half an hour, my glands went up. I felt absolutely terrible. So we were taking the patient into hospital, and I said, "Oh, could you have a little look at me? My glands are up." That was the only symptom I had. I spent 2 weeks in hospital with viral meningitis. Thankfully, it wasn't bacterial. I spent 3 months off work, building up muscle and things like that to be able to work again. I lost bit of my memory for a time, and I lost the ability to even walk 100 meters without getting exhausted. And that was just viral meningitis. The reason I'm telling you that story is because for me, the onset was glands. It was not the headache, it was not the photophobia, and none of this time I developed a rash. It was only through the lumbar puncture that it was realized that it was meningitis. So it comes in a lot of various ways, different forms it presents to you. Excuse me. So the little ones are most at risk of meningitis. I've written it here because their bodies yet aren't fully developed to fight infections. They haven't built up their immune system. They don't have the necessary antibodies to fight it off. So you will see it a lot in children. We know the most common age groups are young children and young adults. So like you guys at university who are, or who were at least, collective and spend a lot of time together because it's highly contagious. We know that the bacterial strain is the most deadly. Viral tends to be not as serious, but bacterial has got a 10% mortality rate. Let me just see what I've written. Oh, I have written that. Yeah, people can be left with lifelong disabilities. You will see children who have had to have amputation of the limbs, etc., because the bacterial meningitis affects them that badly. So look out for it. You won't necessarily be able to tell whether it's bacterial or viral on the road. That will come with the hospital tests. But be very vigilant to it and have a high degree of suspicion. So if you think it's meningitis, act like it's meningitis. You don't have to have a rash in order to give benzopenicillin. It's worthwhile you looking up in your jar of calc benzopenicillin to see the actions, to see exactly what it says for our recommendations for that. Rash is often the very, very last sign in meningitis. And like I said just a couple of minutes ago, sometimes it doesn't even come at all. Do you remember how to test physically for meningitis? This is pretty neat. I like this. It's obviously motion there for you to have a look at the various tests. So in our neurological assessments, we looked at Koenig sign and Brudzinski sign. So essentially, we are irritating the meninges. You can see a demonstration here of how to do the tests. And remember, if you ever feel wobbly on it, if you forget it, you can type it into Google, but on the neuro page, there is a link to the videos of how to do this. All right, so in this, there is a video. I will attach the video to the Moodle shell, and it will also be available in the static version of this PowerPoint. So click on that, know the signs and symptoms of meningitis. There we go. Know the signs and symptoms of meningitis, but also please know septicemia. It's a little bit different than sepsis, but it's kind of sepsis plus meningitis together. So your main signs and symptoms for meningitis, as you know, are going to be the stiff neck, the headache, the vomiting, photophobia, query rash, the fever, the sense of feeling unwell. When it comes to when it comes to septicemia, the first thing you might notice is the cold hands and feet. That is a massive clue in pediatrics. In adults, not so much so, but in pediatrics, if you find a child that's unwell and the parent or caregiver says to you, they're complaining of being unwell, but there's nothing strange apart from their feet are a bit cold, so I put a pair of socks on. That's a red flag. Feet are cold, peripherals are cold. The body is pulling all of the blood into the vital organs, shutting down. The capillaries aren't getting the oxygenated blood flow. You'll have a prolonged cap refill. Your fingers, your toes, your feet, your hands will start to get cold. Big sign for septicemia. So watch that video, make sure you know about it. No, not now. Okay. So a little bit of information for you on septicemia. As I just said, it's the blood poisoning part of the meningitis disease. So you can read this yourself, but obviously when the bacteria invade the bloodstream, they produce poisons, and this attacks the lining of the vessels. As I said, there's not enough oxygen in all of the parts of the body, and your organs will have to work harder. That's why you get the tachycardia, the tachypnea. Your skin will become colder, or the pediatrics will. So last sentence down there is, this is how symptoms of septicemia such as pale skin, cold hands, feet and rapid breathing occur. So hopefully that will stay within you. Obviously, you know about sepsis. You know more about the sepsis causes. When it comes to sepsis, think about septicemia with meningitis. Think about it, especially in the under fives. Okay, so here's a little visual for you. You can print this out if you like, pop it in your folder for when you're attending to patients. These will be the differences between meningitis and septicemia. And don't forget, some of them actually occur in both. So take a minute just to have a look here and see if there's anything there that you don't really understand. Feel free to pause the video. I'm going to move on. The next topic is dehydration. As you'll know, the child has got less body volume. We know that children's bodies change in terms of the size and shape. So the littlest babies, small toddlers, etc., they will have the big, massive head, small body. Then as they grow, obviously their limbs grow, they develop neck, well, more prolonged neck, etc., and their body surface area changes. So as we've said in previous chapters, you've got to be thinking about the size of the child and their blood and fluid volume in their bodies comparable to the age that they are. So dehydration is very, very easy in children, and it's not always obvious. So if you think about dehydration, you probably will come up with some signs and symptoms. For example, say dehydration to me, I think of low blood pressure. I think of dry mouth. I think of headache. So the reason I'm thinking about those is because I'm